Hello, hello, hello. Welcome everybody to Power to the People Town Hall. It is another Tuesday night and it must be 7 o'clock because we're here. I am not Dr. Wiley White. Even though I look a lot like him, I'm not quite as handsome as he is. But we are here tonight. As you know, we have been discussing we've been doing a series on COVID. And so tonight we're going to be talking about how to stay healthy during COVID. Yes, we know we should be washing our hands, wearing our mask, all of that great stuff, social distancing, trying not to go places that are not a necessity. But we do have some health experts here tonight. We have some doctors, some nurses, we have some essential workers, frontline workers here tonight to help us more emphasize the importance of this and just be here for any questions that we may have. So let's get started. We want to first welcome Dr. Nancy Hartwicker.
Hello, I'll just introduce myself. I'm Nancy Hartwicker. I'm a family physician. I've worked in several different areas, including clinic and the hospital, but I currently work full-time here in Greenwood, South Carolina, doing hospice and palliative care.
Great. Thank you for being with us tonight. Next, we have Dr. Rampey.
Hello, I'm Austin Rampey. I'm also a family physician working in Greenwood, South Carolina. I predominantly work in the hospital right now, taking care of adults. And I've been in Greenwood for at least the last 3 years working in that position.
Great. Thank you for being with us tonight. Next, we have Dr. Palenko.
Hello, everyone. I was born and raised in Dominican Republic until I moved to New York City in 2008. And then I moved to South Carolina in 2011. I've been practicing hospital medicine since then, and currently in Greenwood, South Carolina.
Welcome. Thank you so much for being with us. Lastly, we have Willetta Childs, registered nurse. Willetta Childs.
Hi, good evening, everyone. My name is Willetta Childs Jones. I'm a registered nurse and have been a registered nurse for 23 years. I was self-memorial birthed me. Richland Hospital in Columbia raised me. I still work for now Prisma. I do utilization review, so I stepped away from the bedside. So I try to get the hospital paid as much money as possible at this time. So,
all right, thank you as well for being with us this evening. So you see, we have a wealth of medical expertise here. So let's just jump right in with some of the questions. And I always like to explain that we do have questions, but this is a free-flowing show. So if anyone if our audience has any questions or anything like that, then just jump in there. You guys, if someone says something and it sparks, a thought for you, hey, go with it, okay? All right. So our first question is, and we'll go with, let's say Dr. Palenko on this. Why is it important for us to be active in our state-issued stay at home orders?
Well, I think it's always important to stay active, not only during these times, but at all times. Staying active helps control your blood pressure, it helps lower your cholesterol, triglycerides. By doing that, it decreases your risk of having other issues like a stroke, heart attacks, metabolic syndrome, arthritis, even cancer. Staying active improves your mood, boosts your energy. It can promote better sleep. And by doing those things, it will decrease your risk of anxiety, depression, and other issues like that.
All right. Anyone else want to weigh in on that? And also I would like to add, what are some social distancing ideas in order to stay active, but at the same time stay at home? Anybody can chime in.
I would say I would chime in on everything that Dr. Polanco mentioned. Obviously, we want to avoid poor health, and being active is a really good way of doing that. What we do know about coronavirus and COVID is that people who have high blood pressure, diabetes, obesity, heart disease, these are the type of people that are hit hardest by coronavirus. And so being active is obviously a very important part to prevent those things and also lessen the severity of those things. But to answer your question a little bit further about how to be active, I think anything that we can do to get ourselves off of the couch, I think is an important thing. So yard work, cleaning the house, obviously those are some things you can do around the house. My family and I like to go hiking, so we like to get out in nature. And that's something that you can do in a socially distanced way.
Dr. Wicker or Miss Childs, do y'all have anything on that?
We both basically what we've been doing is walking in our office. We take turns walking. Since our gym on campus is closed right now, because we have a YMCA on our campus at Richland and Baptist. Park Ridge, I don't think have a YMCA. So we walk downtown. Now, the thing is about being safe, so we go in pairs. So two of us may go at 10, 2 or 3 will go at 11, 12, whatever, make sure we get a walk. So.
Yeah.
Because we're sitting all day, so.
Yeah, I agree with all that. I think those are all great ways to stay active. We like to, on a daily basis, just go for a walk in our neighborhood. You just want to make sure you're avoiding big crowds, even outside. You may sometimes get somewhere and realize, like I took my kids somewhere the other day, I thought it was going to be nice and outdoors, and I got there and there were tons of people in this area, and so we just turned around and did something different. So really the biggest thing is just to avoid crowds of people, but walking in the neighborhood, walking around downtown, there's lots of Christmas lights up a lot of places, getting you and your family out is definitely going to be healthy.
Right, great. All right. So this one at you, Dr. Rampey. How much activity do adults need?
So generally, what we recommend is that people get somewhere in the ballpark of 150 minutes of moderate exercise. So that means exercising to the point where a moderate amount of exercise is exercising to the point where it's a little bit difficult to talk at a normal rate. So that would be a moderate level of exercise, and you could do that 10 to 30 minutes a day. That can get you sufficient exercise. And one thing we know from research is that it doesn't have to be 30 minutes all at once. It can be 10 minutes in the morning, 10 minutes at lunch, and 10 minutes in the evening, and that'd be sufficient to keep your heart and your body healthy.
That's interesting. I didn't know that. Now, I've always known about the 30 minutes, and I'm like, and my life is kind of like, and I'm like, it's really actually hard for me to find a consecutive 30 minutes. So that's good to know that I can break it up.
Yep.
Cool. Okay. And it's also good to know, making the correlation between having certain underlying conditions, how exercise actually would help that. So we don't need to shun away from that at this time, but this is the time we really need to, if never before, be more active to help offset that with the virus being so rampant right now.
Yes, ma'am.
Mm-hmm. All right, Miss Willetta.
Yes,
is it safe for me to be active outside? I think we kind of covered that, but I'll let you go into detail.
Yeah, I mean, it is safe for you to be active outside. Of course it is. As the other doctor was speaking, avoiding crowds. It's kind of hard to do that sometimes, especially when you find yourself going to places that have a lot of people that's going to be there, whether it's Walmart, where they're starting to buy the tissue and Lysol again, or whether it's actually functions. Thanksgiving was, we've seen a major surge at the hospital after
Wow.
Thanksgiving. People decided to go and visit. They rode plane, trains, automobiles, and even though they had on a mask, but outside, just your 6 feet, arm's length apart. We try to teach the people we come in contact with.
I had the same experience as Dr. Hartwicker was saying on a couple of occasions where I've gone somewhere and I saw the crowd and I was like, let's turn it around, try again. And it's okay to do that. So maybe, sometimes people, get in a tunnel vision and they set out to do something and then they just go for it. But it's okay to change your plans, have a change of plans. So
absolutely.
All right, Dr. Hartwicker, let's see. Is it safe for me to go to, again, another one we kind of talked about, go to a park or a playground?
Yeah, again, I think that really depends on how many people are there, what's going on at that time. It was actually a playground that I went to the other day and was like, no way. I mean, there were probably like 100 kids in a very small area. And this is droplet. It's mostly transmitted by droplet, meaning sneezing, coughing, breathing, but it can be from surfaces as well. So I would say it really depends. What is a park? Can you go outside and walk on the track and there's not a lot of people? Absolutely. Should you be at a playground like I saw the other day with 100 kids? Probably not. So it really depends on the number of people there and what's the concentration. But certainly there are going to be parks that are safe if you can distance and that sort of thing.
That was something I was wondering about, because even if I took my son to a playground and nobody was there, well, how long ago was somebody there touching and sneezing and coughing on the equipment that's out there? So, now could we maybe bring some wipes if we wanted to wipe down everything that our child was going to touch? Maybe so, but it's safer just walking and kind of stay distant from making contact with random items, so to speak. Would you say?
I think it's the safest thing, yeah.
Okay. All right, we're going to bounce back to Dr. Polanco. Describe how does the virus attack our bodies?
The virus enters your body and it attaches to your cells, and there's a receptor on your cells. There's called an ACE2 receptor, and that's what lets the virus get into the cells. Once it gets inside the cells, it starts replicating, making more copies, and those copies will come out and infect other cells. That ACE2 receptor is present on multiple cells throughout your body, including your respiratory airways, your mouth, your nose, your bronchi, and your lungs. There's a lot of ACE2 receptors in your lungs. That's why it's one of the predominant places where the virus will attack. But that's the main way how it gets into you.
So what you mentioning that, because I see something that just tears me up. I don't know about anybody else, but I see where we wear our mask incorrectly, not covering our nose. And I'm covering my mouth while talking. I'm sorry, but
yeah,
is that something we need to talk about, the correct way to wear our mask? Is it okay to wear a face shield without a mask? What about that?
So yeah, I think that is like you said, is important to clarify the right way to wear a mask, and I see it often as well. People outside walking and they have a mask, but they have lowered their mask and they have their nose is not covered by the mask. The idea is to cover both your nose and your mouth, both to prevent you from releasing any viral particles outside that may go into someone else, as also to prevent any particles to come into you. The use of the shield is helpful too. It's not a substitute for the mask. So wearing a shield is not better or as efficient as a mask. Wearing the mask is the ideal. if you want to do both, it gives you more protection. That's what we do in the hospital for, when we are in contact with patients. We wear both a mask and a face shield, but the face shield does not replace your mask.
All right, I'm going to repeat that because I want to make sure our listeners hear it, and then share this. Tell your best friend, cousin, mama, brother, sister, uncle, baby, daddy to wear your mask over your nose and your mouth. And if you have a clear face shield, it does not replace the mask. It is a great addition, but do not neglect wearing your mask and wearing it correctly. All right. So let's talk about some foods that can help boost our immune system and that can help fight off the virus. What are some good food items that we can intake, Dr. Rampey? Uh-oh, I think you're muted. There we go. I hear you.
Generally, I would recommend a healthy, balanced diet. I don't know that there's any one magic food out there. If there was, I think we would all eat it at all times. But there are lots of foods out there that are better for our bodies. But generally, we need to start with a balanced diet. As long as we have a balanced diet with protein and fats and carbohydrates, then we're starting from a healthy base. If we start from a healthy base, then we can start trying to focus on eating more healthy foods. If you need something sweet, leaning more towards fruits, leaning more towards those types of things would be better than, say, processed sugar like candy or otherwise. Eating more complex carbohydrates like sweet potatoes, are healthier than, say, potatoes. Or like just strictly pasta, eating brown rice as opposed to white rice. But these are all general principles that can be applied to our whole life to help us have healthier weights, healthier, blood pressures and the like. So no magic one food, but I think if we were to adopt a healthier regimen, that could help us. I myself, I was actually challenged by Dr. Polanco a couple months ago. I've been noticing a lot of weight around my girth, so I started eating a balanced diet, and I've lost 20 pounds. So it's helpful, and I think ultimately getting to a healthier you is going to help you fight coronavirus ultimately. So
in the little bit of time that we spent together, what it sounds like to me is that as vast and rapid as coronavirus is, if we would just commit to a better lifestyle altogether, that is a way of a defense mechanism in itself.
100%. I think that that's one of the best things we can do for ourselves. I mean, one of my partners who was kind of on the less healthy spectrum as far as what he was eating, he was scared by coronavirus and started eating much healthier. So yes, I think that we do need to adopt a more healthy lifestyle, and that can protect us against not just coronavirus, but against other viruses or infections our bodies could encounter. What we know is that diabetes is a huge predisposer to severe infection, and it prevents our immune system from functioning properly. And so if we can get our blood sugars under control and get our weight under control and get to where we have a better controlled lifestyle in that regard, we're going to be better protected.
Okay, that's good information. And speaking of diabetes, because I'm actually a type 1 diabetic, so
and that's not your fault, right? It's not something you did to deserve that. But yes, like in type 1 diabetics, obviously your blood sugar's high. It's not because you're significantly obese. It's because you have your immune system has attacked your cells that make insulin. So your blood sugar is going to get high. And so what we know about people with type 1 diabetes that's uncontrolled, their blood sugar gets really high, and that prevents their immune system from functioning properly, and they are predisposed to infection. So it's similar to type 2 diabetes in that way. Obviously a different mechanism, but similar. So yes, I think maintaining adequate control of our chronic diseases, including our weight, can help us not be as sick.
Great, great. Well, I myself, I jumped on the elderberry bandwagon. So is that I clearly understood there's no magical food. But are there, like, I know, you know, in years past for common colds and flus, it's said to get in a lot of vitamin C. Is there any fruits or specific vitamins or anything like that, elderberries, anything like that, that you may want to add? Or is it, again, it's just the well balanced, and if you put those things with it, it's neither here or there, it's fine or not?
I think that there's a lot more research that needs to be done on some of these things. But what I can tell you is that we have found that vitamin C can boost your immune system. And so specifically fruits and vegetables are really important. It's not just the oranges that have vitamin C. It's a lot of vegetables too. So that gets back to kind of that regular diet. Now, you know, you can lean towards more healthy things like honey for sweetening things. Obviously, a honey is a safer, more healthy alternative than granulated sugar. As far as elderberry, I don't specifically personally know about the research regarding elderberry. I have a lot of friends who talk about it. I don't think that it hurts you. So I have no problem saying, you know, try it. It's not going to make you sick. So I think there's not any problem with using things like elderberry or, you know, essential oils or other things like that. But what we have to recognize is that these things can't be in place. I don't think they should be in place of what I would call studied or well understood treatments. So, you know, I would never say, don't take the antibiotic, the doctor says, just take the elderberry. I would say if a doctor thinks you have an infection, you should take that medicine, but that doesn't mean you can't take the elderberry or something else. So that's my personal opinion.
Okay.
But again, I don't have any problem with things like elderberry, you know, so.
Great. I completely understand it, especially from your area of expertise, which is what we're asking about. So, okay. So guess what, guys? You can keep your elderberry, but you also need to have a balanced meal, and you need to get 3 10-minute sessions of exercise in. Okay. That's where we are so far. All right. Let's see. Okay. Dr. Hartwicker, why are older people at higher risk?
Yeah, I think we've all heard that with COVID that people who have either chronic medical conditions, are older, or both are at risk for having complications from COVID. And there's a lot of reasons for that. Some of it's probably still yet to be fully understood, but there are some things, people older than 65 are very, very likely to have one or more chronic medical conditions, like Dr. Rampey and Dr. Polanco mentioned. So certainly, your diabetes, hypertension, coronary disease, the things that are more common as you age are things that are going to put you at risk. But actually, even apart from those chronic conditions, our older patients are at risk for having bad complications from COVID. And really, as you age, your immune system weakens, probably similar to other things like your bones weaken, other things like that, and make you more vulnerable to infections really of any kind. We've always known that influenza affects our older patients more, and COVID has proven to be that and more. In addition to just having a weakened immune system, you're actually, as you're older, more likely to have something called a cytokine storm, which is where your immune system actually overreacts to the virus. And produces a lot of chemicals to try to fight off the infection. Due to this inflammatory reaction, you can have significant damage, including, multi-system organ failure, particularly with COVID. It's that kind of ARDS, inflammatory lung disease that you see. So there's lots of reasons that our older patients are at risk for that.
Is that kind of like an autoimmune, I think it's called? type of reaction?
It's kind of a hyperimmune reaction, like your immune system is overreacting and, you know, causing a lot of inflammation in the body, and particularly the lungs with COVID, but it really can be can affect all your organ systems.
Okay. We have a question from the audience, and part of my kind of fumbling around while you were speaking, I was trying to look at that, and it is, and this is a great question. What is your advice to deal with the mental anxiety dealing with this COVID pandemic?
That's a really great question, and I'm definitely going to let our other folks take this too, but I'll speak just personally. I'll tell you that I think in a lot of ways we're all in this together, healthcare providers, you know, as well as everyone else. There's anxiety from people trying to homeschool their children, from people not having as much social interactions, not having their normal church functions, that sort of stuff. So it's just stressful in general right now. I know that very early on, I told myself, I realized after I had basically decision fatigue, you know, working in hospice, we were having to decide like who can come see their dying loved ones and how many people we're going to allow to visit. And I was just getting kind of stressed about that. And I told myself I was going to make sure I was active every day, particularly outside. I know personally that's what I need to do for my mental health. And I've kept that promise to myself, even during the colder times now. I just put my, you know, my hat and my gloves and my coat on and I go outside. I try to stay connected to my family. None of my family lives locally, and we started doing like a weekly Zoom call where we would touch base with each other because I think it just made us all miss our family more than we normally would. So those are just kind of from my personal perspective that has been helpful for me, but I'm certainly interested in everyone else's point of view on the question.
All right, Dr. Rampey, you want to chime in on that question?
I chime everything that Nancy Hart just said. You know, you got to find the things that you can't go without, right? Obviously, spending quality time with my wife is huge, and my kids is huge. Making time to do more than just watch TV together, right? Sometimes we just are so exhausted, we want to just come home and just crash on the couch, but that prevents us from connecting with our loved ones. We have continued to be able to see some of my close family in Clemson, and we're all pretty quarantined, so we feel comfortable doing that. But as far as our other friends, we've had we've terribly missed them terribly. And so, yes, you know, doing FaceTime, you know, just because you're having coronavirus doesn't mean you can't see them. You know, fortunately, we live in a relatively warm state, despite the fact that it's cold right now. But, you know, you can always see people by sitting on the porch outside. You know, as long as you're 6 feet apart in a well-ventilated place, it doesn't mean you can't see the people you love. So I think, you know, all that's important. Physical activity, seeing the people you love, and, you know, trying to be healthy. So.
Dr. Polanco.
Well, I agree with everything that has been said. I think that the main thing is probably finding something that you enjoy, that you like, and do it in a safely way. You know, keep your social distances, wear your mask, and wash your hands while you're doing those activities, trying to keep yourself and others healthy. And one important thing is for people to not neglect medical care. What we have seen is during this pandemic, many people have delayed medical care because they are concerned about going to a hospital or see their doctors because of the risk of getting exposed. So they're delaying their care until it's too late or the disease process has advanced, and I think that applies not only to medical illness but also for mental illness. Make sure that you go and see the care that you've been having prior to this. Do not neglect that.
Nurse Willetta.
I agree with everything as far as the mental anxiety, because I think also people need to stop news watching and keeping up with numbers and trying to and listen to this person and that person and who's an expert and who's not an expert and who has knowledge about this and who has knowledge about that, because a lot is still developing. It's a lot of things that I see on a day-to-day basis. I review charts all day long, so I'm continuously seeing something that this virus has caused that the person did not have. One of our team members died from COVID. So that was a major loss in case management, because we are not direct contact workers with patients. So to lose a staff member because they were inside of the hospital and they contacted the disease, then we all had mental anxiety even coming back into the office to work. It was something that we had to deal with. So we all talked about stop looking at the news. We stopped following all that stuff. It's almost like when the election was going on, sometimes you have to turn away from media, in order to have a sound mind and to your mental to stay intact. You have to turn things off and tune out.
All of that is great information. And one of the reasons that we're here is to try to get out positive and correct information. So I would say to that question, thanks for tuning in tonight. Thanks for asking the question. Sometimes anxiety is just simply the unknown, in which I understand that a lot is unknown. But when you can learn as much as you can, that helps chip away at what is unknown, which hopefully will help chip away at some of that anxiety. Some of the things that you all mentioned are things that I've personally had experience with. Like we did a Zoom Thanksgiving. Our family is really large and we have people from everywhere, and some sectors of the family got together with their immediate family, but we didn't all come together. So each little group of family, we got on the Zoom and was able to, see everyone. When COVID first hit, we were actually doing Zoom workouts together. Some of the ladies in the family, we got on Zoom and we had, one person lead the workout that day or whatnot. So there are certainly ways to be able to see your loved ones. I had a best friend who bought a house, and she wanted me to see the house, but she's one who is very, very, very cautious. And so, we did social distance. I went to the house, didn't touch anything. We stayed 6 feet apart while she gave me the tour with my mask on and everything. So you certainly can, just do some things to help bring the anxiety level down, and to just to concur with everything you guys have just said. So yeah, thank you for that question, Latoya Funderburk. All right, let's see, where are we now? All right, we talked about why older people are at higher risk. So let's go to Nurse Willetta. Can a person be infected with the virus more than once? And this is a great question for you because you get to bill them once or twice.
Oh yeah. Oh yes, they can. And now we are seeing the secondary infection coming back.
Wow.
So far, I do every weekend. So far I have seen probably about 10 cases where
Wow.
they have tested positive for COVID-19 back in March, April. They had negative tests, did well, went home or wherever they lived, and now they're back. Their symptoms are different that they're presenting with, and the treatment is, of course, different because in the early beginnings, it was a different treatment. Now we're doing something totally different. So we are seeing the second round, which we didn't know at first was going to be, you can get it again. We thought, oh, okay, build up an immunity, because we had a lot of our nurses who were positive and they were given plasma. One of our case managers was the first nurse to get the plasma for convalescent plasma. She was on TV. And I mean, she went just donating plasma, thinking, that was her cure to save the world. And then, but it's not. So
Dr. Polanco, could you weigh in on how one could contract it twice or multiple times, should I say? And you're on mute. Okay, there we go.
Sorry. I don't think we have enough information to answer that question on how. There are, multiple ways that can happen. One of the things that we know is that what makes you immune or resistant to a virus is your body being able to produce antibodies, and that those antibodies are long-lasting enough that they will be able to protect you next time you get exposed to that virus. Now, what it's possible is that those antibodies do not last long enough, and they disappear, or the concentration is not enough to stop the virus from infecting your cells again. And it's one of the things why the new vaccine that we're getting, you actually get 2 shots, because the first time you get the first shot, you don't make enough antibodies to be able to neutralize the virus. And that's why you need to get a second shot a month later to boost that immune response and try to make enough antibodies to be able to suppress the virus and prevent the infection. I think that also what we know, not from this virus, from the past, is that people who have chronic illnesses, elderly, and have other chronic medical problems are less likely to mount a good immune response. So maybe they're not able to make enough antibodies to be protected in the future. But again, I don't think we have enough, information to give a clear explanation of why people can have a second infection or a reinfection. But I agree, we have seen cases of people who tested positive and they were treated, and then they tested negative multiple times, and months later they're back in the hospital with another infection.
Okay, so I want to make sure I understood you correctly. The vaccine will actually come in like a 2-step process. Is that correct?
That is correct. The 2 vaccines, the 2 main vaccines that are being worked on, which is one by Moderna and one by Pfizer, they both need 2 shots. You need to get 1 shot and then a secondary shot a few weeks later.
Okay. Nurse Willetta, in those cases that you saw, were they with patients who had underlying conditions, or
Some of them was, the ages varied, all adults, because all I do is work with adults. So when I say adults, that's 21 all the way to your geriatrics up to 100-year-olds. And then some patients did not have chronic diseases. The youngest I seen that had the infection twice, he had it in April, and his symptoms are not bad, but he came to the hospital to get tested again. And he ended up, because he had a little bit of shortness of breath, and then he was able to go home the next day. So he was what we call an observation. So he was not an inpatient. He didn't stay long. But he got reinfected by his boss at work. So the boss ended up getting it from somebody or something. So that's what happened with him. And he was in his 20s. So with no underlying issues, but he lost his sense of taste, smell, and he had some shortness of breath. So his symptoms were very mild.
Okay. All right. Let's see. With you being on the front line of essential workers, you can be the first to receive the vaccine. How do you feel about taking it? Let's start with Dr. Rampey.
I am going to take it without reservation. Obviously, some of the big concerns I've heard out there, it was made too fast. How can we trust it? Another concern is they've not tested it enough. Another concern, those are the 2 main things I've heard. What I can tell you is that both of the primary vaccines that Dr. Polanco mentioned were tested in over 40,000 people. And both have been found to be extremely safe. What we will find out, I believe, is once we give it to, 10 million, 50 million people, are there going to be very few severe side effects? Yes, there always is. There's always 1 or 2 or 3 severe side effects in a million or 10 million or 50 million people. That's always the case. But what we have found is that these vaccines are extremely safe, and that they're extremely effective. I will have no problem taking it myself. I've told people I'm going to take it as soon as they say that I'll get one. I'm going to go get one.
Right.
And I think, from my understanding, what they have communicated to us is that we probably will have access to those vaccines in early December or mid-December. I'm not 100% sure about that, but I will get it as soon as I can. So that's how I feel.
Dr. Hartwicker?
I'm on board to take it for sure. I don't know that I'm considered first line. Like, they've tiered it. I think they'll start with ER, ICU, pulmonology, hospitalist, and hospice and palliative care. We may be kind of the next step down, but as soon as it's available for me to take, I certainly will. I think there is a lot of fear surrounding it, and that's understandable. I think that's really been the case with new vaccines across the board. I was reading actually about polio vaccine when it came out, and there was a lot of fear surrounding that. And you think about polio now, like we've essentially eradicated it. So I will be taking it. My family will be taking it when it's available to them. I have a child who has a congenital heart problem and would certainly be at risk if she got coronavirus. So I'm very excited about this coming up.
Nurse Willetta.
Some of in my American Nursing Society, they've already started taking it. Some of my nurses across the board have already taken it. They have done well. So definitely going to be taking it. To me, I just feel like it's the flu shot, hepatitis B, whatever we had to have. As you all physicians know, we had to have a series of vaccinations in order to go through school to work in this profession. So it's no different. So same.
Dr. Polanco?
I feel very strongly about the vaccine. The results I have seen are awesome. Very minimal side effects from it. So as soon as it's available to us, I'll take it.
I heard you say minimal side effects, and I heard Dr. Rampey speak, on possible side effects. What are some of the possible side effects?
Some of the side effects that they reported on the studies were just like with any vaccine. Sore arm, body aches, headaches, things like that.
So just the normal.
There were no serious side effects reported with any of the 2 main vaccines.
All right. So just the normal, your body adjusting to something new.
Correct.
Okay. Well, that's a little reassuring for me, because I'm one who's always like, I don't know. But I can certainly understand, especially in you guys' profession, your sentiments towards it. I know at one time I used to work at Self Regional, and they were doing the flu shot, and I refused to take the flu shot. And this is before I found out I was diagnosed. But I refused to take it. And they was like, well, if you don't take it, you gotta, I think, maybe wear a mask. I think maybe we had to wear a mask then. I wore that mask for about 2 hours on my shift, and I was like, you know what? Just give it to me. And I'm still here. So, so like you said, just like anything, just something new sometimes can be a little scary. But if we look at history, we've had some really good medical results from that vaccine. So I do understand that.
One quick thing about these 2 vaccines that are new. Both of these vaccines are produced in a rather new way. They use something called, I'm going to use a science word. They use something called mRNA. mRNA is like a copy of the DNA. So when our body makes proteins, it goes to the center of our cells, to the DNA, and makes a copy of the DNA, and then uses that copy to make something. All right. These vaccines are an mRNA copy of a piece of the virus. Okay. So then they take that piece and they inject it in our arm. Then your body makes a part of the virus, not the whole thing, just the outside part. So then your body makes an immune response to it. Okay. Then that mRNA dissolves in like 12 hours. So this is a completely new thing. You don't get exposed to the real virus or a deadened virus or a partial virus. You get exposed to a piece that doesn't get incorporated into your body. It dissolves afterwards. So this is potentially a complete game changer as far as the way vaccines are produced. And I think the safety and the effectiveness into the future. I think that a lot of vaccines are going to be produced in this way in the future. So I'm really excited about it. So I just wanted to share that.
Well, that's great to know that, you know, I think medicine is so innovative. And so that sounds like, you know, a great direction for vaccines, period, like you said, or just for the medical field all together. So that's interesting, and that's great to hear. All right, we got a few more questions. We're a little over halfway through them, and we got about 10 more minutes, so we're going to try to shoot through these real quick. Okay, what would you say to your community that is doubtful about taking the vaccine? And I think you guys covered that, but does anybody want to add anything to that?
I guess one thing I would say, I hear a lot of people talking about the shortcuts taken to develop the vaccine, and I guess I want to reassure people that a lot of the shortcuts that were taken were more financial, meaning they funded a bunch of vaccine trials at the same time, where normally they wouldn't do that many at the same time. So, and you know, there's some shortcuts in FDA. It wasn't shortcuts in scientific method, and I guess I don't know if that helps anybody, but that's some stuff those are some things that I'm getting feedback from people, you know, worried about shortcuts. So the shortcuts were, you know, basically because this affected the entire world at one time, basically, they just poured a ton of money into funding, you know, multiple vaccine trials at the same time. Austin, okay. Anything to say about that? I mean, I just thought that was maybe helpful for someone to think about.
I think that does bring a lot of clarity to what that means. I get it. So instead of trying 1 or 2 at a time, let's say they may have tried 10 at a time. And that was, of course, because of the urgency of the need.
Right.
Okay. That's okay. That makes a lot of sense. That's good to have clarity on that. So do we hear that, community? Like there was no shortcuts in the safety of it or the ethnic of it. It was just that we did more research simultaneously than normal. Is that a good way to explain that, to say what you said? Okay, great. All right. What is the policy for the quarantine of students in your county? And actually, that was a question for someone who unfortunately couldn't be with us this evening. If anyone has knowledge of that in your county and wants to speak on it, that's fine, or we can kind of roll by.
I'll speak on it since I still have a student in school that had COVID. Oh, wow. So my 15-year-old was diagnosed with COVID at the end of October because he played football. And all the schools we're in Lexington County. So they've had outbreaks at every single school. They social distance. They did what they called a schedule, a AB schedule. He went to school on the A schedule, so he went on Mondays and Tuesdays, and then he did online. But like you said, we had an outbreak, and he ended up getting it. He tested positive. I tested negative. We isolated. I was still able to work. So the policy is with the students is they have to, the desks are set up to where they only have about 6 or 7 students. I know in Lexington County at this time, District 1, I can only speak for that district. And the buses, every other seat is skipped on the bus. And the problem was what happened when they did the tracing as to why the guys on the football team got it. When they huddled or whatever, when they played football, that's what they're thinking. They wasn't wearing the masks up under the helmets. And so one student or somebody had, and it just kind of went through 13 students. So, now they have an outbreak in Rich Lex 5, which is another district that's kind of between Richland and Lexington County. And I know that they still are practicing separating and having the kids, but those 5 schools now are all at home. They've taken away the classroom. So once they have so many students, as my understanding when I talk to the school nurse, is the school closed down and everybody goes back to online schooling.
Okay. I think that's kind of the same process here in Greenwood. If there's an outbreak, we pull and do a quarantine time. Okay.
Yes.
Okay. What is the current capacity of hospitalization in your city? So we have Greenwood represented and Richland County represented. Dr. Polanco, you want to take that for Greenwood?
Well, exact capacity, I think it's a hard question to answer. We have a 300-bed hospital, and we had 30 beds ICU. Now, back in July, August, when we had a peak in COVID, we increased that capacity. We added 15, 20 more ICU beds. So we had to stretch our staff and stretch the number of hours they had to work, which is not ideal. But we had to do that in order to handle the number of patients that we were seeing. Right now, we're not at that point, and we're hoping that people will take social distances and wearing the mask seriously, so we don't get to that point again.
Dr. Hartwicker, I know you're over at hospice. Is that correct? Okay. What was it? Was that those numbers like there? Did you guys receive anyone in hospice like due to COVID, or how did that?
We've had several patients in our home setting that have had COVID. Actually, a couple of them have recovered, which is surprising given everything that's going on. This is a strange virus, Some people with all the comorbidities in advanced stage do fine, and then we have some that don't. I think the biggest strain so we have had several cases. We've also had several staff members, and we are a very small organization. So if we have one nurse out, it's really a big strain on everybody. And then, we will really rely, we go into the homes. I do home visits. Our nurses go into the homes and see patients there. So one of the biggest things that's affected is our caregivers. So if you have a caregiver who gets COVID, they're out of commission. That leaves obviously them sick, and then the patient without a caregiver. So there's a lot of ways it's affected, other than obviously we have had patients who've been infected by the virus as well.
Nurse Willetta?
Our numbers are starting to go back up. When the outbreak first started, what we did, because we do have 3 hospitals, that's not including Lexington, they're not a part of us. I can only speak for the Prisma Health. The Park Ridge Hospital only took in labor and delivery. So we circumvented everybody who needed any other type of services downtown to either Baptist or Richland. If they were COVID positive and needed to go to the units, they normally went to Baptist. And we separated oncology patients because of their low immune system. So we had to keep those people. So they actually had a pretty good system. And Actually, we just had a meeting, a Zoom meeting today about going back to that because we are seeing the numbers go back. Now, they were talking about stretching the staff. The funny thing about what happened with us, we ended up getting furloughed, and they were furloughing nurses because a lot of percentage of our patients came from surgeries, major surgeries and traumas, because we're a level 1 trauma hospital. So it was like nobody was driving, nobody was getting in accidents. So we wasn't really seeing the numbers up there. So actually nurses were getting sent home. And that was an issue in the beginning. So we actually had like a Zoom meeting earlier today about how they're going to deal with all that again.
When something like that happens, okay, in your case, over here we're stretched and over here we're furloughing. Is there a way to like bridge that? Can we borrow you guys who are needed?
They try, but like myself, like I said, I've been a nurse for 23 years. I came away from the bedside 5 years ago, so I am a dud. I couldn't help. I could not help them on the floor. Now, what I could do is we had command stations. I could man a command station as a nurse on the unit. I made sure that the nurses were in proper PPE, had the proper PPE, that's the protective, personal protective equipment, made sure the masks and stuff, make sure they was doing the proper hand washing when they came out the doors, taking the temperatures, that type of thing. So I could do that part. But if you told me to go hang some plasma on somebody, then you might not want me to be your nurse that day. So, but yeah, so that's kind of what they kind of found us other things to do. So we wasn't just a wasted body, and we could help out. And a lot of us did go to the ED because we seen our, essential staff down in the trenches, and we wanted to help them. I mean, we felt, helpless. And they're tired. So we want to help. So we went in the offices and we look, what can we do so we can help them out?
Well, we're here at 8 o'clock, and I want to respect you guys' time. And I know you guys are working hard, and I appreciate your time. So I'm going to skip down to one last question, and we'll wrap it up. And plus, I think the other questions have in some form been answered anyway. So this last question: what can we as a community do to support and encourage our healthcare workers? Let's go with Dr. Rampey on the first one.
So I think what a lot of us on the front line have been frustrated about is when we're in the hospital taking care of people who are dying, and all we hear on the TV and the radio is how people don't want to socially distance or wear masks. It's terribly frustrating because I think people just don't see it. If you don't see it, it's hard to be vigilant. I truly believe that by the time this is done, by the time we get through COVID on the other side, that all of us are going to have somebody we love dearly that dies of this. I hope that's not the case, but I think it will be. But until you have somebody that you know and love that dies, you might not know to be careful. So, I think from my perspective, please, 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 be careful. As I said before, it doesn't mean that you can't do anything. It just means that you have to do it differently. I still go to Lowe's when I have to. I still go to the grocery store when I have to, but I wear my mask. I have my hand sanitizer in the car. I wash my hands. If I eat at a restaurant, I eat outside. I don't like to eat inside. The other day, a little while ago, we ate in a restaurant away from everybody else, and it freaked me out. We got to do things a little differently. And so that's what I would say.
So if everybody would do things differently for a little while, we can kind of get over the hump. It's like we're prolonging it the more. Dr. Hartwicker?
I agree with what Dr. Rampey is saying. I think that's been one of my biggest frustrations in all of this is, you know, you go to school and you train and we want to care for patients. That's what we love to do. It's all of our calling, you know, but then to have people doubt what's happening and what we're seeing, I think has been really frustrating. So I think just listening to, again, not the hype on social media, but listening to healthcare professionals that you know. I mean, I'm out there, you know, I'm not just a doctor here. Like my kids, you know, have been in the schools. I have a church, you know, all these things. So hopefully people might know me and, you know, listen to what we have to say about this disease process. You know, other than that, I think I've had a lot of people do some, you know, very encouraging things for me. There's been some churches who've left like little care packages for us. You know, our local Chick-fil-A got stuff for our nurses, just little things like that have been really encouraging for us. But, you know, I think we certainly in healthcare, it's been challenging, but, you know, I want to remember that there's other people having challenges as well. Our educators are certainly overwhelmed. Our pastors are trying to learn how to minister in a new way. And so I think we're all, you know, struggling in our own way. So,
Dr. Polanco?
I don't have anything additional to say, but that, like Dr. Rampey said, is very frustrating to myself as well. Going into patient's room with COVID-19 and they're coughing in my face, and we're trying to do our best to get them better and get them out of the hospital. And then people are outside not wearing their mask and not washing their hands. And what I hear a lot of people say is, well, I'm a low risk, so I don't have to wear a mask. And it's like, well, the one thing is it's not just for you. You need to think about your neighbors or your family member or that other person who is in a high risk population who you may expose by you not wearing a mask. And then they end up sick in the hospital or dying from this disease. So I'll say, please wear your mask, wash your hands, practice social distancing.
Nurse Willetta?
I was for the ones who are working directly with it to see that, because it frustrates me when I see people not doing what they're supposed to do.
So really, what I'm hearing collectively is the best way to help you guys is to help ourselves, take care of ourselves, do what we're supposed to do. It's not really a crazy request or a stretched request. Just wear your mask, social distance, wash your hands.
One last thing, a story from the other day. Unfortunately, these things have very eternal consequences for people. The other day, I was taking care of a patient in the intensive care unit. He had coronavirus, and he was getting worse. We made the decision that he needed to be intubated. Now, what we know about people who get intubated is if they're that sick, a lot of times they don't do very well. And so I had to help him FaceTime his wife and his boys and tell them bye. Mm-hmm. I sat there with him while he said goodbye to his loved ones, mm-hmm. and he might not wake up. Mm-hmm. That's what's happening in the hospitals. Mm-hmm. And it happened in Italy and China and Europe, and it's happening here. And it's continuing to happen every day across this country. And it's terribly sad. I buried a good friend of mine the other day with COVID. So it's going to touch us all. I hope it doesn't, but.
Wow, that's a very impactful story. It's kind of, I'm fighting back some tears here. It's emotional. but it's facts. And you know, I mean, even now, even just hearing, you know, when you mentioned having to bury your friend, it makes me think about those in the mortuary profession. Is been very difficult on a lot of them, because you don't know who you know passed from it. When someone comes into the mortuary, a lot of times you don't know the cause of death yet, and so it's even strenuous on them and protecting them. So even after someone passes, it's still plaguing. So yeah, that's something for us to think about, guys. So to everyone listening, again, you know, just please wear your mask correctly over your nose and your mouth. Wash your hands. Use hand sanitizer. And say thank you to an essential worker that you run into. Just say thank you from 6 feet away. Well, again, thank you all for being our panel guest this evening. There was a wealth of information given here, I believe, that can help the community and can help us get through this from a medical standpoint. Well, again, we just thank you, and we hope you all have a good night. Bye. All right, Town Hall. I hope you guys were empowered by our panelists this evening. This was a great show, great information. And here's the great thing about it. If you missed it or there's someone you want to share it with, guess what? You can replay it. You can go back and share it with someone. I encourage everyone to please share this broadcast. It was great information here. We also want to remind everyone on Thursday nights about our virtual Good Night God with Minister Sheila Fielder, who would just be doing a simple little small devotional with you in the evenings and a prayer with you in the evenings, just to encourage our hearts. The word tells us to think, you know, on things that are of a good report. So we're going to go to sleep on his word and on a prayer with Minister Felder. So that's 10 p.m. on tomorrow, Wednesday night, and that's every Wednesday night at 10 p.m. So we hope you enjoyed this evening's broadcast. Thank you again for being with us. We love you. Good night.